Hello guys, welcome to my YouTube channel Medifirst Academy. Today I'm going to discuss about CHADS scoring system. If you haven't subscribed my YouTube channel yet, please subscribe and hit the like button, then you will be notified when I upload the new video. Let's move on to the topic. CHADS scoring system is used in the non-valvular AF patient to determine their possibility of stroke formation in the next 12 month of period. That is we call as risk stratification scoring system for non-valvular AF patient. I will start my lecture today like this. If you have the patient with the non-valvular AF, after you manage this patient acutely, then before discharge that patient, you have to determine this patient, you should start the anticoagulant or antiplatelet drugs, because of when you have the AF, there is a high risk of getting the stroke and thrombotic event in the next 12 month of period. How you going to determine that one? You have to use this CHADS scoring system and get the particular score for that patient and decide on the anticoagulant and antiplatelet drugs. So this CHADS score, each letter is dedicating and representing the different component. So we are going to discuss about this component which is representing as these letters. So then you will be realize how many point can gain in the each component, and what is the maximum scoring for the CHADS score and the minimum scoring CHADS score, and how you going to utilize that one and determine about annual stroke formation percentage in the next 12 month of due period. So letter C is standing for the congestive heart failure, and here letter H is standing for the hypertension, and letter A is standing for the age more than 65 years old. But you have to remember in here, your patient age should be less than 75 years old. If your patient age is more than 75 years old, you have to give the 2 point. If your patient age is 65 to 75, then you have to give the only 1 point. Then next one is a D. D is standing for the diabetic mellitus, and S standing for the previous stroke. Then vascular, V standing for the vascular disease like MI, and A in here A standing for the age more than 75 years old. SC together stand for sex, and especially in the female category we can consider in this SC together. So in each component have then the separate allocation of the points. Usually for the previous stroke and the age more than 75 years old, the two category, they have 2 point each. Other all categories what happen, they have only 1 point each. So total number of maximum number of score you can gain for CHADS score is we can say 9. The minimum number of score is 0. Out of that, you have determined whether your patient is candidate to start anticoagulant to antiplatelet and discharge and follow up in your routine clinic. So and here I would like to mention in here, your CHADS score is high, your patient he has a more chance of getting the thrombotic event in the next 12 month of period. So in next slide I am going to show you how that annual stroke risk is going to be high according to your CHADS score. Suppose your score is 0, then your annual stroke risk is 0%. Suppose your score is 3, then your annual stroke risk is 3.2%. Right? Suppose your score is 6, then what about your annual stroke risk percentage is say 9.8. If your score is 9, then there is a more than 15.2 annual stroke risk percentage is there. That's mean there's a 15.2 is a very significant number percentage. So you have to address that particular problem, medical issue, and decide on whether this patient is a suitable candidate for the start the antiplatelet and anticoagulant. Otherwise, the patient will end up with the stroke or MIO, very serious medical condition if you neglect this anything on her discharge. So here you have to mention, you have to remember your CHADS score is going to be high, same as proportionally your annual risk, stroke risk also going to be high, right? So according to the total score, total number of point your patient going to be gained, you have to categorize your patient is low risk, moderate risk and high risk. How you going to categorize? If your patient's gain score is 0, then you can consider that patient is a low risk patient to develop the annual stroke in the next 12 month of period. So that particular patient, you don't want to start any prophylactics like antiplatelet or anticoagulant. But suppose your patient is 1, then you have to think about starting the antiplatelet or anticoagulant in this patient. I will explain you why in little bit of time later. Then you will be realizing some patient in here, female patient with the score 1, you don't want to be much worried. But male patient is score 1, you have to be worried. I will explain why it in a little bit of later. Then if your total gain of score is 2 or more than 2, then definitely he or she is a candidate to start on oral anticoagulant here. Now here I have mentioned like this: if your patient is female, score is 1, consider as a low risk, and there is no anticoagulant is recommended. It's mean if you have the female patient, then if you after you apply the CHADS score, you get the 1 point because only because of she is female, then you don't want to start the anticoagulant for that patient, as we consider low risk. But if your patient is male patient, with the same number of score is CHADS score is 1, we consider that patient as a moderate risk, right? So then that patient is a candidate to start definitely antiplatelet to anticoagulant according to her status, right? Then if your patient definitely that patient have the score is 2 or more than 2, that is recommended to start the anticoagulant, right? What is the anticoagulant we are going to use? Is warfarin. Is a commonly available drugs in your hospital setup. So warfarin, when you're going to start warfarin, then you have to before that you have to do the PTINR and get the basics value of PTINR, because your target PTINR is definitely 2 to 3. So until that you are going to adjust your dose and keep the PTINR in between 2 to 3. In here, and when you achieve your PTINR in between 2 to 3, then you have to continue that warfarin dose under close observation of the patient. You have to definite patient, you should be follow up in the proper clinic setup. Then you have to do the regular PTINR and try and confirm his INR not going to be that much higher than 3. Then that one, those things you have to very strictly follow that patient. Otherwise, patient might end up with another series of the medical issues. So I'm going to explain you how you going to calculate your CHADS score with the help of this example. Now suppose you are one of the 76 years old female patient admit to your hospital ETU with the palpitation and chest pain. Then her past medical history is significant with the hypertension, dyslipidemia, history of ischemic heart disease 2018, and PCI to the LAD and the RCA done. The past surgical and allergic is unremarkable. You have examined the patient, patient vitals are stable, and she is hemodynamic stable, BP also 110/70. Then the pulse rate is a little bit of tachycardic, patient 134. Irregular pulse is there. The saturation in the 98 in the room. Yeah. When you auscultate your lungs and your patient's lung, then you found some fine bilateral fine crepes. So you are ordered that patient to ECG. ECG shows the fast AF. Then you have to manage the patient fast AF first of all, and the acute management after your acute management. Then you have to decide on your CHADS scoring system and decide on to start the antiplatelet and anticoagulant for that particular patient. How you going to apply for that CHADS score? I am going to show you in this example. Then you will be easily realize how you're going to use it and when to use it. Since this patient is age is 76, you have to give that age category 2 point, because your patient is 76. Then if it is more than 75, you have to give the 2 point. Since your patient is female, that one also she can earn another one point, right? Since she has a comorbid hypertension, separate 1 point is you have to allocate. For the DEM, you have to allocate another 1 point. History of ischemic heart disease is there, then you have to allocate another 1 point. Totally 6 points you can give this patient. So she is a definitely candidate for the start in the anticoagulant and anticoagulant, as I told you previously, right? But here another score system is there. We call that actually Hasplate scoring system. This Hasplate scoring system will assess you the risk of bleeding intensity in your patient. Before starting your anticoagulant, or the patient almost is on the your antiplatelet anticoagulant, you have to apply this Hasplate scoring system and determine about the major bleeding risk percentage for that patient. So I'm not going to details in this video regarding the Hasplate, because of it will my video will be a little bit of longer then. So I am going to discuss it in separate video. So I would like to invite all you guys to see that video, and also then you will be you can get the holistic approach to how to start an antiplatelet and anticoagulant, and when you come to those antiplatelet anticoagulant, what are the risk factors and the medical issues you have to be maybe address. Those things you will be learn in the next video under my topic of Hasplate scoring system. So thank you for watching. I hope you guys enjoy the video. If you like my videos, then you please subscribe my channel and like my channel. So